Okay, so at the outset, I would like to offer my sincere thanks to the organizers for giving me an opportunity to stand in front of you and share my thoughts on a subject which is as old as 2,500 years. I have also a mixed audience. I have distinguished healthcare leaders like Dr. Puranik, Dr. Khanna, Joyanta Sharma, and others. And at the same time, I see a lot of young faces who are the future of healthcare of this country. So, I have to talk very carefully so that it can cover both of you, the young and the old. Sometimes it is fact that the world belongs to both you and us together. But ultimately it belongs to you. So most of my talk would be directed towards you who are quite young, who would be there in this world to serve these people. Now, my topic is patient engagement. Some of us are doctors, some of us are healthcare leaders, some of us are clinicians, some of us are nurses, technicians, and support staff. But one thing is common for all of us sitting in this hall, that is patient. We are doctors, some of you are nurses, some of you are technicians. It is because there is a patient. If there is no patient, we have no existence. And regarding patient engagement, if we look at more than 2,500 years ago, the father of modern medicine, he's still the father of modern medicine. He did not have a stethoscope. He did not have a thermometer. He did not have CT, MRI, robots or anything. But he's still the father of modern medicine. His vision was unimaginable. It is difficult to believe that a doctor can have so much of farsightedness. I keep wondering. Even at the time, he told us that, listen to the patient. Listen to the patient. Examine him. You must not forget to explain him what you have got and what you have thought about, and then document it. So, listening to the patient is a patient engagement. Explaining him what he has and what needs to be done is another stage of patient engagement. So it was started 2,500 years ago, not new. Then another great doctor is none other than Sir William Oscar. He was a great Canadian physician. He is known as the father of medical teaching. We are being taught medicine in a different way, both doctors and nurses. I keep telling Udmana every day, hospital is our lab, Baba. You must take care of this lab. Unless there is a good hospital, you cannot train a good nurse. It's the lab. Unless you have a good hospital, you cannot make a good doctor. It is the most important lab for us. And he first introduced how to train a doctor in bedside. That's why he is being still known as father of medical teaching. Father of medical teaching. What he said? He said that medicine is an art. It's not a trade. It's a calling, not a business. Not a business. And both brain and the heart needs to work in tandem to make medicine meaningful. There cannot be a better example of patient engagement than what Sir William Oscar said almost 200 years ago. Right? Then the other two great doctors, Doctors Bidhan Chandra Roy and Dr. Bhubaneswar Borah of Assam, they were great doctors. Why? Dr. Bhubaneswar Borah's clinic had only an X-ray machine and weighing machine and a microscope to see stool and urine. Nothing more than that. He could do hemoglobin, he could do ESR. But he's still the greatest doctor of Assam. Why? Why? He tried to understand your patient. He gave more emphasis on understanding the patient rather than the disease. You must be able to make a clinical diagnosis. That is fundamental. But whom you are treating, what he is much more important. Most of our problem, the doctor-patient conflict, hospital-patient conflict, arises out of the fact that we do not try to understand our patient. You must only remember, a good doctor or a nurse treat the disease, but a great doctor and a great nurse will treat the person and the family. You must important. We must learn to look at beyond the disease the patient is suffering. What is more important for all of us to know and remember that we must be able to feel what my patient and the family is passing through. If you can understand that, if that is reflected in your verbal communication, body language, you cannot do anything which can make the patient unhappy. Unhappy. This is very, very important. This is nothing but patient engagement. Bidhan Chandra Roy had it. That's why he is the greatest doctor of this country, which observed Doctor's Day on his birthday. That's why Dr. Bhubaneswar Borah is a great doctor. They could feel what a patient and the family is passing through. Yes. This is patient engagement. Then there was another doctor. He was like my friend in USA, Dr. Don Bartwick. He had established the Institute of Healthcare Improvement in USA. Institute of Healthcare Improvement. He said that he was a patient activist. We are all patient activists. Whenever a crisis comes, we always take the side of the patient. Be it a doctor, be it a nurse. That is our nature. We are patient activists. He started telling that nothing about me without me. That means without asking me, without discussing with me, do not decide about me. That is, you could understand it. Not only that, there were many things which were being echoed from the patient, from the family member, across the world. Treat me nicely. Heal me. Explain me my illness. Give me options. Explain me the risk of any treatment modalities. These were echoes of the patients. Do not hurt me. Ask me what I want. Explain options. Explain risks. Be proactive. Engage me in my decision. Treatment. And that is called shared decision. Patient needs to be involved. Patient needs to be involved. So, what is healthcare? Healthcare involves two groups of people. One group consists of doctor, nurse, healthcare leaders, and other support staff on one side of healthcare. Other side of healthcare is the patient, the family members, the friends and relatives, and his well-wishers. It is one human being taking care of another human being. It is one human being taking care of another human being. Please remember, A human being, all doctors, all nurses, all technicians, we do have a body, but more importantly, we also have a mind, right? Unless we are taken care of both, we will never be happy. In the same way, for a patient, do not think only about his body's sickness. Think about his mind. Think about his mind. Unless you treat a patient with love and affection, kindness and caring, respect and dignity, honesty and truthfulness, you cannot get patient engagement. That's very, very important. These 8 words should be your Bible, should be your Gita for a doctor. For a doctor. Then, how does patient engagement help you? It ensures better outcome. It improves patient satisfaction. It gives you repeat business. An individual on a yearly basis requires 4 to 16 consultations. If that is so, there is no doubt of patience. 95% of the people in this world moving around you are harboring at least one disease in their body. 40% of the people in this world are harboring 5 diseases in their bodies. So, you don't have the doubt of patience. What we are having, we are lacking in is that we are unable to create a product which my patient can afford and accept. Healthcares are now working as a one-code solution. I have a dress, I have made a coat, you have come to my shop, if it fits into your body, you wear it, if it does not, go away. I don't go there. I don't go there. Right? It's not customized. It's not customized. That's why, though there are people, they are not able to come to us. 60% of the beds in this country remain empty, though we do not have even 25% of the beds required for this country. Why? It's because we are not customer friendly. We have not been able to develop our hospital which the patients will like and appreciate. That's the main problem. You go to big corporate hospital in metropolitan cities where Professor Dr. Borah had said that most of the doctors are situated in metropolitan cities. 80% of the doctor would be roaming around the corridors of the hospital in search of a patient. We don't have enough number of doctors. At the same time, with public resources, we are creating these doctors. They do not have access to patients. That's the dichotomy this country is suffering from. Now, how do you address it? So, I have already told you that through patient engagement, if they become happy, if they become satisfied, they will come back to you. Your hospital will remain full. Don't worry. Your hospital will remain full. Let us create a hospital which my patient can accept it. That's where the problem is. Second, there are certain challenges, of course, for patient engagement. We do not have enough number of doctors and clinicians. You know what is the density of the doctors in this world? There are countries where there are 1 doctor for every 10,000 people. There are countries where there are 84 doctors for every 10,000 people. It ranges from 1 to 84. And where do we stand? India has got 7 doctors for every 10,000 people. Is it enough? Assam has got 4 doctors for every 10,000 people. Assam has got 4 doctors. Though we have doctors, those doctors who are good. Again, Dr. Puranik is sitting here, there are other teachers sitting here. I realized that because of the faulty selection system of our medical students, we create 30% bad doctor. They are good for nothing. They should not have become a doctor. Another 69% are good doctors. They are okay, very busy. And 1% gifted doctor. Less than 1% gifted doctors. Less than 1%. We select students based on knowledge and science, not on aptitude of serving people. Medicine is a hard calling, it's not a business or chat. That's what is happening. We do not care to look at their aptitude, whether he would like to get up in the middle of the night to attend a patient. Whether he will have the joy of serving a man in distress, irrespective of other things in his life. We never look at it. That's the problem. I hope a lot of reforms has come in this country with time. During the last 50 years, I have seen a lot of changes are taking place. All of them are kind of good side, good development. This will also get corrected in course of time. Okay, then there are also, so one is the doctor's time. Those who want to do a good job, they don't have enough time to do it. That is a fact. Second, whoever patients come, their level of accepting the care plan are not uniform. So we need to educate them. We don't have a scheme or plan to do that. That is another challenge. Third, the healthcare providers are sometimes resistant to sense. Doing it like this, so many years, why do I need to send it? But our sustainability will depend on whether we are able to send to each other. That is important. Time will send. It does not wait for anybody. Whether we go along with time depends on us. And our sustainability to a large extent will be decided by our ability to sense according to the need of our patients, for all of us. Dr. Sridevi was discussing very intently with Jane before this meeting regarding future of healthcare. So, you are my very good friend for a long time. Our survival in this world will depend on whether we can send according to the need of our customers. According to the need of our customers. So, that is, those are the challenges. Then, the leaders of healthcare has a responsibility. We must make all of our hospital patient-centered. Everything should revolve in and around the patient. When you order a share, think about your patient, the order is share accordingly. When you order for an equipment, think about the patient. It should be patient-focused, patient-centered hospital, patient first. I always tell them, if there is a phone from a VIP and a phone from a patient, pass on the patient phones to me first. But we have not been able to percolate very fast. Of course, business takes time, but it should be patient-focused, it should be patient first. Even Mahatma Gandhi said, I had a big dilemma. Who is more important in a hospital? Me, other doctors, patient, nurses, who? After a lot of debates and discussion within me, I came to the conclusion that patient is the most important VIP in GNRC campus. In GNRC. Rest are secondary. He is the most important visitor in GNRC campus. So, that's how leaders will have to engage more on patient than on anything else. Then this is possible. This patient engagement environment is possible. Before I conclude, we have time limitation also. I will just share a couple of my personal experience with you. What I see personally in my professional life, I started treating each and every patient coming in touch with me as God. I don't worship. I don't visit any temple. But whenever I see a patient, I treat him as my God. And unknowingly, my hand, last part of my examination, will touch his feet. He does not know that I am doing it. I don't have to instruct myself, but automatically my hands will go to his feet. That's my culture. Nah? We touch the feet of somebody when we want to show our respect or reverence. So I do that. When I do that, patients also start treating me as God. Then our relationship is a godly relationship. There is no question of doctor-patient conflict. It's a relationship. I cannot lie to my God now. I'll try to do my best to my God. So also patients treat me as his God. So that was my personal philosophy. If it helps you, you can also try it. Treat your hospital and the ICU as your temple. Doctors, others, do not have to pray God separately to reach to the heaven. If you can take care of these people, that is the straight way to your heaven. Treat your working place as your heaven. Then, if you look at patient, you ask yourself, are the patients always right? The honest answer is no. Patient is not always right. But irrespective of who is right, a patient deserves to be treated with love and affections, kindness and caring, respect and dignity, then honesty and truthfulness. Remember, based on three things patients come to you: quality of care, cost of care, and overall experience. Okay? Cost of care, to a large extent, for the economically weaker section of the people, has been taken care of by that unique scheme which Ms. Loskor was mentioning. Dr. Poranik was also mentioning, that is PMJY. I was born in the year of Republic year, 1950. In last 50 years, 75 years, I'm almost going to be 75 after a couple of weeks. This is the best time for healthcare. Private healthcare has developed in front of our eyes. But this is the best time for do something in healthcare. I never saw such kind of environment during last 75 years. If we don't do it, we miss it. It's our responsibility to contribute to healthcare. It's needed. It's needed. So, medicine patient may not be right, but irrespective of who is right or wrong, he should be treated like that. Then, quality of care, cost of care, and overall experience. More than cost, quality comes first. What is quality in healthcare? That is again for getting patient engagement. Quality means promptly. Most of the problems arises in hospital because of what? Doctor did not come and attend the patient on time. Nurse was not there, it took her 15 minutes time to come to respond to patient needs. So time is life and life is time. Attend promptly. Quality, first thing is promptly. It's not big instrument. It's not CT, MRI, cath lab. Remember it. It's time, promptly attend to your patient. That is number one quality parameter. Do it correctly. Do not make the patient guinea pig. Nobody wants that to be. Okay? Treat them appropriately. For that, hospital should be a place of learning for everybody. Each hospital, big or small, should have a improvement program, learning program. Learning program. Do all the practice and rehearsal before that. Do not experiment with patients. They do not know. So, promptness, appropriateness, and empathy. I have already said what is empathy. Ability to feel what the patient and the family is passing through. And if you can do that, you are an angel. They will remember you. They will come back to you again and again. They will come back to you again and again. So, I think my time is over, right? Okay. So, thank you very much for
I want to tell something about Dr. N.C. Borah that I read around 15 years back while I was doing my specialization on entrepreneurship from EDI Ahmedabad. My expenditure was reimbursed by FNST Germany. I was doing a specialization on entrepreneurship. I never met you, sir. Today, seeing you, all my respect and regards to you. When the syllabus of the entrepreneurs were written, there, your story was there. How Dr. N.C. Borah became an entrepreneur for the Northeast, living in Mumbai, if I'm not wrong. All this, it's a beautiful story. Beautiful story. I never thought of meeting you. It's a great day for me. It's a great honor for me. I'm seeing you. That story motivated me like anything. And since I'm a motivational speaker, I reach out to the youths, women, special group, social workers. Many places I have narrated your story. I have tried to motivate the people of the Northeast to become entrepreneur and follow his path. It's a great day for me, sir. Really, really. Thank you.
Thank you so much, sir, for your informative presentation.